Ayurveda, the ancient traditional medicine of India, defines health as a state of complete physical, mental, spiritual well-being. The focus of Ayurveda is on predictive, preventive, and personalized medicine. The approach of Ayurveda towards positive health shares its features with the factors such as promotion of health education, individual awareness, integration of spirituality and ethics in healthcare system that may be applied in public health management in order to improve perceived and objective life quality, limited drug use, avoiding expensive side effects, and reduce chronic diseases. Ayurveda, the oldest healthcare system, is now getting popularized around the globe. The Government of India is trying to integrate the Ayush system with the national health programs. Being the stakeholders of Ayurvedic system and to participate actively in public health as well as in personal health programs, Ayurveda has to offer a lot in preventing and curing the disease. Under the specialities of Shalya, Raktamokshna is a parasurgical procedure widely practiced and gaining popularity day by day. The English terminology used for Raktamokshna is bloodletting. Bloodletting removes toxins, cleanses the body, and is indicated for maintaining the health. Raktamokshna is a meticulous, controlled extravasation or expelling out of vitiated blood by different procedures like venesection, siravyatha, horn application, sringa, god application, alabu, leech application, jalaukavacharana, scraping, prachana, cupping, khati yandra, and by suchi vyadhana, needle aspiration. Ayurvedic doctrine explains that in case of bloodletting, being vitiated by vata, pitta, and kapha dosha, it should be let out by sringa, jalauka, and alabu respectively. In case of vitiation by 2 or 3 doshas together, siravyatha is to be adopted. Siravyatha and leech application are commonly practiced when patient comfort is considered. Susruta advocates in chapter of Shonita Vannaniya Adhyaya, verse number 34, Tvak dosha grandhaya shofa roga shonita jaschaye Raktamokshna Sheelanam na bhavanti kadachana. Periodic bloodletting can prevent skin diseases and cures so many diseases due to vitiation of blood. Another important quote, Yantyashu vyadhaya shantim yatha samyak siravyathat siravyathat chikitsartham shalyatandre prakirtitaha, gives emphasis that it is chikitsartha, means most of the diseases can be treated by bloodletting.
He is suffering from varicosity of the vein in the lower limb. He is having the varicosity in both of the leg. But today we are going to do some Raktamokshna procedure. Raktamokshna means a meticulous outletting of blood to create some therapeutic effect. So for that, this patient is having varicosity of the vein, and the examination, clinical examination, everything has done. Even the color Doppler test was also done. And today we have examined the patient. The BP is normal, 127 by 73. Pulse is 72 per minute. So today the patient was selected to start the Raktamokshna. Now the pre-procedure of the Raktamokshna will do. Initially some Snehal and Svedana has to be done before going to this Raktamokshna. After that, to increase the venous congestion in the lower limb, we have to tie one tourniquet at this part, so that the blood will be collected in the lower limb, and we will put a scalp vein, otherwise one 20 gauge needle, so that the blood will come out. The aim of making this tourniquet tight is to stop the venous drainage towards the up, so that whatever the venous blood will be there, that will be collected in the lower limb, and during letting out it will come out. If it is not more tight, above this grip bandage also, once again we can tie another tourniquet, so that superficial venous has to be congested. All the superficial vein will be congested. So now, though we are directly manipulating the circulatory system of the patient, so before pricking, we have to take all the aseptic measure, and it will be better if we are puncturing the vein which is present at the peripheral part of the body, so that more amount of venous congestion will be there and that can be let out Otherwise, if the blood is not coming out properly, when a dilated vein at the superficial part also you can prick.
A 70-year-old diabetic male patient is suffering from multiple ulcerations on the lateral medulla, and for that we are planning to collect the impure blood from this area with Jalokavacharana. Raktamokshna by Jalokavacharana is done in 3 steps: pre-operative, operative and post-operative procedure. In the pre-operative procedure, we are first preparing the patient as well as we are preparing the Jaloka. For preparing the Jaloka, we are keeping the Jaloka first in tamarind water for few minutes, and then we are keeping the Jaloka in fresh water. And when the Jaloka retains its freshness and vivacity, we are applying the Jaloka on the affected area. Usually, Jaloka is applied directly to the site of ulcer, but sometimes Jaloka fails to stick to the affected area. At that time, we will give a prick. And if still the Jaloka fails to stick to that area, then we will refuse that Jaloka and we will take a fresh one.
So I will now try to show another new technique of leech application, because what happens, sometimes the leech may not be applied at a particular point where we are about to apply the leech. So for that, a new technique we have evolved, that you have to take the plunger of a syringe and the leech has to be placed inside the syringe. So the leech has to be entered like this, and the same syringe we can put at the area where the leech has to be applied, so that it will take a little bit of time to adhere to that particular point. So then simply we can keep it out. Sometimes the other end of the leech may stick to the syringe, but that is not a big problem. When the leech will become bigger in size after sucking the blood, then simply we can remove along with the syringe also.
Is Raktamokshna painful? Whether the patient need to be anesthetized or not?
Usually Raktamokshna does not need any anesthesia. And regarding pain, it may be slightly painful. Raktamokshna, if we are going for ShalyardhaDocumentary, at that time, while pricking the needle, at that time a little bit pain will be there, just like an injection. But when we are doing Jalokavacharana, at that time, when the Jaloka will start biting, a little bit pain will be there, and when it will start sucking, at that time it will release some anesthetics so that the pain will subside. In case of Prachana, we are doing parallel superficial cuts we have to do, superficial incisions we have to give. So because of that, patient may feel a little bit burning type of pain, but after the treatment, the pain will subside. And usually it does not need any anesthesia.
Does the procedure requires hospital stay?
Raktamokshna does not need a full-day hospital stay. However, 1 to 2 hour hospital stay is required for the procedure, and a few hours rest is advised to the patient, especially to avoid complications like bleeding after walking over a distance.
How much amount of blood can be let out in a single sitting?
The total amount of blood which is let out will depend on the disease and also the strength of the patient. Normally, by Jalokavacharana and Prachana, a small amount of blood is let out. The textual references say that it's around 540 ml to 620 ml, but practically that much amount of blood will not be let out from the patient. In ShalyardhaDocumentary, maximum nearly 300 ml amount of blood is let out.
Ayurveda explains by Raktamokshna, one can remove the Dushita Rakta from the body and the Shuddha Rakta will come to the area of disease. As per the modern parlance, if decongested venous blood is removed, that will enhance reperfusion of that part by fresh and oxygenated blood. That fresh oxygenated blood may bring so many bioactive chemicals which can initiate the repair of the pathology. Blood is a potential media for increase decrease, and maintenance of homeostasis. Hence, by a meticulous bloodletting, the natural process of homeostasis can be triggered, which in turn might be able to cure a number of diseases. Hence, Raktamokshna is considered as Arthachikitsa or Shalyardha by Susrutacharya.